Hey, Cancer Warriors, it's Tanya with Power Pantaloons, and I have a special guest for you today. Please welcome Mary Fran to the program. Hello, Mary Fran. How are
Oh,
you today?
I am so good, Tanya. Good to be here. Thanks for having me.
I'm honored to have you. We're going to talk about your experiences with cancer, or maybe cancer. We're not sure, because your story is really interesting and not typical. So why don't you start where you want to start and tell us what's going on?
Okay. Well, in 1991, I was diagnosed with lung cancer, and it was a new pulmonologist, and a doctor who takes care of your lungs. So I had to go to a new doctor because my insurance decided not to pay the doctor I was with for 5 years. And so the new doctor said, one X-ray or CT scan, I can't remember which, he said, you have cancer, you need to get it out, just like that. And so I thought, man, I need to talk to my old guy who really knows me. He never told me. So I said, no, I want to wait. I didn't say I wouldn't do it. I said, I want to get a second opinion. And he was so adamant. He actually called my husband he did, to enroll my husband. And my husband's scared to death. He's hearing lung cancer. Oh my God.
Oh my
But
God, that is a violation of your rights.
yeah, yeah, yeah.
Holy crap.
He did. And so I talked to the other doctor, and the other doctor said, you have 50-50 chance because the lung operation would take so long, your lungs might not be able to handle it. So I'm thinking 50-50, it's not worth the odds to go for the surgery. I could 50% would be if I didn't do it too. So hey, I'm not doing it. And you know what? Nothing happened. Nothing.
Well, clearly, because you're still here. So you just trusted your gut on that.
Yes.
Like, did you and your husband have lots of fighting over it because of
Well,
that call?
he respected my choice, but he was scared to death.
Of
And as
course.
time went on, I was okay. He got easier with it. So then, fast forward almost 20 years, and another pulmonologist asking me to do a pulmonary CAT scan, told me that I had two tumors that looked cancerous in each of my kidneys, two cancer tumors. So I went to a urologist. That's the doctor you go to if you have kidney problems. So I go to the urologist. First guy says, you should, you needed to have surgery yesterday. So I have you scheduled for surgery in 3 weeks. No, he didn't just, I had a business.
Didn't ask you or anything. He
Oh,
just told you
no,
what
no,
was going to
no.
happen.
Great. And so I'm in shock. And I say, I need to think about this. I want 3 months. And he said, no diet, no supplement, and no prayer is going to save you. You need to do this. And I stuck to my guns. I said, I want 3 months. And I said, I will call you when or if I'm ready.
Yeah.
And he would, it was interesting. He just started telling me things that made me more sure I didn't want to do, like saying, well, 83% of people have success with this surgery. And I'm thinking, 13% don't. Are you kidding me? Uh-oh, So what I did is I scheduled another second opinion. So the second guy said, he took another CAT scan and said, oh, it didn't grow in those 3 months, you know, and I tried I went to an alternative doctor who, gave me, 1,000 supplements and, oh my goodness. But every time I went to that doctor, the supplements changed. So I was a little confused and it was costing me a fortune. So anyway, I go to the second urologist and he says, it didn't grow much at all in 3 months. He said, this is slow growing. He said, maybe you could outlive it. And I said, oh, I know. I'm thinking, I just saved myself from surgery, and he's telling me I could outlive this. Well, then, but he wanted me to come back again and again, to have more, CAT scans. And so I said, so, what was I going to say? Then he tells me the next time he says, how long did your parents live? And I said, oh, 90, And he said, oh, well, then you're not going to outlive this. You better do it.
Oh my goodness.
So, and I went to doctor number 3 and, it went on and on. And, this is 14 years later. And, what happened with the kidney was, well, first of all, the first guy told me that there was only one cancer, the other one was a cyst. But the right kidney had a tumor that did grow. So they were telling me if it grew, it had to be, you know, um, malignant. Well, the
I don't think that's true.
I don't either. Well, but what happened after 8 years, the tumor got smaller, but then it got bigger again.
That's not normal tumor
No,
behavior.
no. But you know what? The urologist didn't tell me that, but I kind of knew. And I started complaining to my once a year doctor, the checkup doctor. And I told her my sad story about all these. I went to 5, 1, 2, 3, 4, 5 urologists. And I said, they all tell me the same thing. What they say is, oh yeah, you could die from, on the surgery table because of your lungs. They can't handle it's 3-hour operation, for the surgery I would need. And they say, yeah, you could die, but you should do it anyway. I mean, just like, what?
Like pass the butter, like normal conversation and not like
Oh yeah, not. It's just like that makes sense, and it didn't make sense to me, So anyway, now I get once a year your ultrasounds, and it doesn't seem to matter, it goes up a little or it goes down a little, but who cares? So,
so what I love about you is that you're not afraid to question the what the doctor tells you, nor are you afraid to get second opinions. And I think that is fabulous advocacy for yourself. A
yeah.
lot of people just hear what the doctor says and allows them the power to make all of the decisions and remains passive in their own healthcare. And I think that that is criminal. The only
Yeah.
person that is responsible for your healthcare is you, and you need to be an active participant in it.
Well, I had a lot of experience. First of all, I was in upper years when I was diagnosed the first time, but I had had a lifetime of difficulty. I started out in life with terrible lungs. By the time I was a year old, I was diagnosed with asthma and bronchitis and you name it. By the time I was 14, I was told I had emphysema at 14.
Yeah.
I had when I went to the first pulmonologist that the insurance cut me off from. He told me he did a lung function test and I had 16% of my lung capacity. 16, not 60, 16. And what I didn't know was he thought I was going to die. And he told me he couldn't take care of me, but he was going to put his pulmonary nurse in my care so that if I called and needed something, she would give it to me. But he wasn't taking me as a patient. And I thought, sounds, this sounds bad.
Sounds
It sounds
sounds
pretty bad.
weird, right?
Yeah,
And that explains why you couldn't handle a lung surgery.
right, right. Um, and really, my lung capacity went up to 19% when I was with that first pulmonologist. And he said he'd never seen it in 40 years of his practice. He had never seen anybody gain lung capacity. And that was because I was getting medicine that was working. And now it's up to 38%, but it's still anything what I've learned is anything under 30% lung capacity is you're going to die. You are going to die soon. So,
You've just
yeah,
made a decision that that's bullshit and you're not going to
that's
accept it. And
right. I'm going to keep going.
I know we're not supposed to ask, but how old are you?
I'm 80 years old, young,
80,
80 years young.
80 years young, right?
Yes.
You, I think mindset plays such a huge decision. It is such an important factor. Uh, for me, when I was diagnosed, they gave me a 5% chance of survival. I
Wow.
had a very aggressive, very stage 3, phase 2, and it was two different kinds of cancer and a very
Wow.
rare uterine cancer, right? So it was a carcinosarcoma, so a
Mm.
carcinogenic sarcoma. I mean, and a healthy uterus is 4 ounces. When they took mine out, it was over 10 pounds. So I had 10
Oh.
pounds of cancer in my body. There were no markers in my blood. The pap smear came back fine. The ultrasound, the transvaginal ultrasound, they even did something called a sonohistogram, which is where they inflate your uterus with saline and then they image it. And that came back fine. When I say fine, it was either fine or inconclusive. They literally had to do a DNC to find my cancer.
My.
And, right, like, and the only real symptom that I mean, I was tired all the time, but I attributed that to my weight, right? But I had just a heaviness in my abdomen. I felt like I was PMSing all of the time. And I was like, this is not right. And my body's like, this is not right. Do something.
Hmm.
And I had a beautiful gynecologist. She would say to me, she goes, okay, so this test came back fine or inconclusive. The next step would be blah, blah, blah. Do you wish to proceed? There was no judgment. There was like, it was glorious, right? Like she was
Mm.
very logical about it. And the it was supposed to be like a 3 or 4 hour surgery, and it turned into like an 11-hour surgery, something like that,
Oh, dear
just
God.
because I at the time I was almost 400 pounds. It was because I was fat. And um so when I was when I was told 5%, I no thank you. Like, no thank you. Absolutely not. I don't want to hear anything about expiration dates. I don't want to hear any of that bullshit. And that's what we did. We put together a plan on how we were going to kick cancer's ass. And
Mm.
having the mindset, like, so when a doctor gives you an expiration date, first of all, how dare, right? Like,
Mhm.
you're that's
Yeah.
not acceptable. It's really not. Like, you can give a prognosis, you could say your prognosis is really poor, but telling somebody that they have 6 months to live, I don't think that's right. But people will accept that, and if you accept that, your body's like, oh, okay, so that's the plan. Your body's going to do what you tell it to do. I really believe that.
Yeah. Yeah.
So
Yeah.
you just wholesale decided
Right.
that you were not going to accept any of your limitations, and here you are,
Right.
80 years young.
Yeah. Yeah. And yeah, yeah, I I figured as long as I'm here, I'm going to do my best to live to the fullest that I possibly can. And I always made it through. You know, I had lots of times when I thought I was at my last breath, and I thought, well, if I go, I go. You know, that's how you have to deal with it. And you know, I've had all through my life experiences with doctors who didn't listen to me. So that's made me cautious and know that I've got to direct my own ship, you know. Um, and I thought it was because I was, you know, early on, I thought it was because I was very short. I've always been short, but also because, you know, I looked young, you know, until I'm older. But, you know, anyway, I thought not this didn't happen to many people. And then I realized that a lot of women have that experience, you know, and it doesn't matter what your size is, you know, it doesn't matter how young or old you are. You women get overlooked. I had doctors give me medicine by an IV that I told them before they put it in that that would not work for me. I had bad experiences with that drug. They did it anyway, and I was worse off as a result. You know, we're talking breathing wise. You know, I would leave hospitals, you know, sicker than when I went in. So I had to be very careful in my life.
Yeah. A lot of women talk about medical gaslighting and the horror stories, but most of all of the research that has been done has been on white men. So all of the treatment plans are geared towards that. And our symptoms as women are different.
Yes.
And
Yeah.
they're just now really starting to care about that because we're making them, because
Yeah.
we're tired of the nonsense. Like people of color have an even more uphill battle, right? Because their genetics are a little different when it comes
Yes.
to that, and their symptoms are different. And all of that needs to be addressed.
Yeah.
The
Definitely.
it boggles my mind the entitlement and audacity really of the medical committee, just continuing this bullshit. And it's very frustrating as not a white man to have to stand up for myself every time,
Yeah.
I go into a doctor and the first thing they tell me is, oh, you have diabetes, right? Or high blood pressure. No. And they're always surprised. And I'm like, I'm real healthy for a fat person. Stop judging me by how I look.
Right. And the other thing is, you know, it's not that you're fat, it's that you have a disease that they haven't figured out how to help. You know, one reason people eat more than they need is because of the foods that we have available. You know, you can speak to that, I'm sure. Yeah,
The stuff that they put in the less expensive food, the box food, is truly
right,
atrocious.
right.
And body size does not indicate health, because I have definitely encountered individuals that look healthy that are absolutely not,
Oh, for
right?
sure.
You know, and the perception that our society puts on somebody just based on appearance, it's frustrating.
Yes,
But for the most part, I ignore it, right? Because I'm happy. I'm down 75 pounds. I figured out exactly what's going
congratulations.
on for me, and I really have embraced holistic wellness, right? Like I feel it's important to walk your talk, right? So
Good for
I
you.
finally figured out the key. And a lot of it is doing the mental gymnastics of working through your past traumas.
Yes,
I,
yeah.
I was assaulted violently when
Mm.
I was 5, and I ended up with gonorrhea. That's how they figured
Oh,
out that I was
dear God.
assaulted. And I, my body, right? Like, first of all, my mind blocked it out, right? Like, your body protects you. And so my mind was like, okay, so if I'm fat, that's not going to happen again. And I built this
Yeah,
armor,
for sure.
and I have done a lot of mental work to get to the point where we can release the weight and it's actually working at this point.
Good for you. But that is really sensational to lose 75 pounds. That is so difficult to do. I really, really honor you for the work that you've done. Truly.
Thank you. Well, first it started with the mental work, right? Like I had to address my inner child and make her feel safe and do a whole bunch of that stuff. But also I discovered 10x Health and Gary Brecka, who's a human biologist, and they have a gene test and they do some blood work, uh, and they were able to help me find out which of my actionable genes weren't methylating correctly. And what methylation is when you put the nutrients in your body has to transform them into an acceptable. So how it works, like you can't put crude oil into your gas tank. They have to change it first. So that's basically,
Yeah.
so your body changes it. And for me, I don't methylate folate correctly, and that is
Right.
like 40% of Americans can't
Yes.
can't methylate
Right.
that correctly.
Right.
Um, and so I ended up on some supplements that really gave me the kickstart. It gave me a whole bunch of stamina so that I could move more. And then I started making smart choices. I stopped with the coffee. Well, I'm drinking coffee right now, but I
Mm,
stopped with the excess sugar. I stopped with the soda. Soda is completely gone and has been gone for 8 months. We went from dinner plate to lunch plate, and then it's
mm-hmm.
one pass, so no seconds. And then we removed most of the white starchy breads of like rice and pastas, and I'll have potatoes or bread or whatever like twice a week. And it's 75% vegetables and 25% meats and fats, whereas before it was lots of carbs, right? And all of that has helped me get to where I am.
Super. And do you know that there are alternatives to sugar and gluten? The gluten in the wheat is the problem. And
So inflammatory.
yeah, and one of the benefits, if you can call them benefits, and there are, of having that the diagnosis of cancer, is that you know I got help. For one thing, my daughter, who loves to cook, took on the challenge, and started looking into alternative sugars, because I went off sugar and I went off wheat. I went off so much I could only eat a little bit. I mean, I had a diet of about that many things. And so researched this and came up with all kinds of alternative sugars that don't make you want to eat more. That, coconut sugar, maple sugar, and it costs more.
Stevia.
It costs more, but you know what? It saves you in doctor bills.
Yeah.
Uh, and the gluten, there's lots of gluten-free recipes that are all over the internet. You can find wonderful recipes, and then you add in the sugar, you play with the amounts of alternative sugars, and oh, my daughter makes the most wonderful foods. A pasta, it's easy to buy gluten-free pasta. It tastes great.
Yeah,
Oh,
like they make it out of beans or
yes,
chickpeas.
right.
There's so many different ways to make pasta now. And I you know, I never really was a giant pasta person. Like fresh made bread, oh, I could eat some
Oh
fresh
yeah,
made
oh
bread,
yeah.
right?
I could
But
too, but I don't anymore.
I do once in a while.
Okay.
But the whole plan is just doing small incremental changes. So as a survivor, I would recommend that you start before you receive some sort of devastating
Yes,
diagnosis.
yes, yes.
But unfortunately, as humans, we wait until it's so uncomfortable before we make a change. But I would love for you to listen to our advice here, right? Make the changes now while you're still healthy.
for sure.
And it, it's interesting. Everybody that I talk to, when we talk about, what kind of changes did you make and how are you feeling now because of them? Getting a diagnosis such as cancer is terrifying,
It
and it,
is.
it does make you really ask yourself the question, what did I do to contribute to where I am right now?
Mhm.
Because you need to ask that question. I Accountability is huge, and so many of us don't don't want to face that. But I think in order to heal yourself, to get through it, you do need to acknowledge that you played at least some role into why you are with that diagnosis.
Or at least you could say um, that you could improve your health. Even if you don't want to say you did anything wrong. I don't know that that's true for everyone, that they contributed to it. I don't know, but certainly almost all of us, 99% of us could improve our diet and our emotional life too.
When I talk with other survivors about that, I hear things like, yeah, I ended up with throat cancer because I wasn't speaking up for myself, or I have heard a lot of sexual assault um caused my uterine, ovarian, I,
Mm,
you know,
could be.
a lot of survivors really feel that those were the causes, and then they'll talk about the work, the therapy, or whatever kind of work that you have to do to work through your trauma. And a lot of them be like, it took me a long time to get there to do the work, and I should have started this sooner. Or I'm not saying anybody deserves their diagnosis or went out and bought their diagnosis, but I'm saying that, you know, you should be exercising, you should be eating the right foods. Are you doing that consistently? And it's not like a blame. I don't want you to blame yourself. I want you to think about the actions that you could have done differently so that you can change your actions for the future. It's absolutely not coming from a place of blaming anybody for that, because
Yeah.
that's ridiculous. I would
Yeah.
never do that. But it's coming from a point of, so like for me, like what could I have done differently? Well, I could have started working on my uh I could have started working on my trauma way sooner, instead of resisting like all of the therapy that I went through. Instead of being belligerent and confrontational, I could have started the work early. I could have exercised more. I could have been there's a laundry list of things that I could have done, but I didn't do. And I've accepted that, I've acknowledged it, and I've worked through it. And I think that for a lot of people, acknowledging what you did to contribute to where you're at is part of the healing process. It's not for 100%, right? Like, not everybody, but do you understand what I'm saying?
Yes, but the thing is, we do find reasons why things happened, just because we're that kind of people. We're all like, there's a little blame back here, and you don't want to come from that. If you
No.
catch yourself blaming yourself, you need to give that up. Um, it could happen to anyone,
Yes.
um, cancer. So
Yes.
yeah. And the thing that it's an opportunity to look at, how can I up the ante on my life? So I made dietary changes that are helping me to this day. I found other benefits, that I really realized more deeply than ever how much I'm loved. It's people, people help me, not just my daughter, and she was the best and is the best. Um, Friends gave me things like herbs, or quinoa, or just, little, um, just nice things, and just they wanted me to live. It's just,
Yes. I no, what I'm saying is not coming from a place of blame, but coming from a place of reflection in
yes, yes,
in a way that you can acknowledge it in a safe environment, not in a shame or blame environment, and
yes,
just say, okay, so these are the ways that I contributed to where I'm at now. So how I plan on correcting that moving forward is this, that, and the other, right? So that, and you're absolutely correct. Anybody can be diagnosed with cancer at any time. According to the American Cancer Society, the current statistic is 1 in 2 will have some kind of cancer before they die, which is egregious as far as I'm
well,
concerned.
yes, it says something about our society. I think what we're eating, what we're breathing, what we're drinking, and I mean even down to water, can be a problem.
I I absolutely
Sadly,
concur
yeah,
because when I was diagnosed 17 years ago, the statistic was 1 in 3, and now that it's one
mm,
in two, we are going the wrong direction. And you're hitting on some really important points with the water. The water has been contaminated. The food, I mean the pesticides, the
yeah,
chemicals, the
yeah,
synthetic stuff that they put into our food, the preservatives, all of that does not do our bodies any good. The the chemicals and stuff that they put in our wallpaper, in the cars, in our shampoo, in
yeah,
our cleaning products, in our everything.
yeah. We have to be very careful. Yeah,
If you look at other countries, they have stricter
yeah,
regulations on
absolutely.
what
I
chemicals can
know.
be put
Yes,
in on or around bodies. And unfortunately, here in the States, it's all about the almighty buck and not really about the betterment of society. And that is a shame.
yeah, and I don't want to um throw shade on doctors. I was saying I have to be careful because I have extenuating circumstances with my lungs. But doctors work for the most part, doctors are working for a group, and you wonder who is running the group because a lot of times you're asked to do tests, or more tests than you would want to do because not some of these tests are not good for you. Um, and I think it's because doctors are being pushed to require stuff.
I can speak extensively on that. I've worked in the health insurance business
Mm,
for almost 25 years, and
wow.
um, so I've done research on this. So the the doctors are beholden to a set of laws that they
Yeah,
have to follow. So when you talk to your doctor about alternative wellness modalities, they legally cannot listen to what you're saying, and they have to shut you down. They cannot recommend. They cannot. They're legally bound not to talk about alternative therapies that they know work
yeah,
if they've
yeah.
investigated
Right,
it, right? Like
right.
they cannot. And for your diagnosis, the health insurance company has a list of medically necessary procedures for each of those, and all of it's based on peer review and what is published in medical policies. And it's a lot, right? Like you need to be able to understand a whole bunch of gibberish, not just the medical terminology, but all of the, I'll call it medical legalese, right? That goes into that. So they're beholden to what the diagnosis itself that you have been given allows them to treat you with.
Yeah,
The
like you're
insurance
another,
companies dictate that. They do. They straight up
Yeah,
dictate that.
that's it. And you're just another number. You're just a thing. You're not a human being with complex issues. That's not taken into consideration. You know, none of the urologists for my kidney would even talk to the pulmonologist. They wouldn't even talk to him. Can you
Oh,
imagine?
right. That's I think that that is the opposite way of going about it. I think you need to treat the whole self,
Yes,
and it's mind,
yes,
body, spirit. But we're at a point where we're putting band-aids on symptoms instead of actually trying to find the underlying causes. And that is because of the pharmaceuticals. Big pharma wants you to be on medication
yeah.
X because
Oh
they know
yeah,
that when you're on medication X, you'll
right,
eventually be on Y, Z, and Q because of the
yes,
effects from medication X. And it's not it's not designed to cure you. They don't want to cure you.
right. Because if they cured you, then you wouldn't be coming back.
Correct. And it's a sad state of affair.
But I'll tell you, even despite the system, there are wonderful doctors out there.
Oh, absolutely.
Yeah,
Absolutely. And most of them went into that field because they want to
right.
help
They can't,
people and they
right,
care
right,
and they really want to help people. They're obviously, there are some rotten apples, but they have gone through
yes,
extensive schooling. And but another thing that you need to consider is with all of the schooling that they have gone through, they don't live in your body. You live in your body
oh yeah,
24/7.
for
So
sure,
you are the ultimate decider on what's right for your body. And
absolutely,
so when you're telling them certain symptoms and they're not listening,
right.
you are well within your rights to fire that doctor
Oh yeah,
and go find somebody else.
for
And
sure.
a lot of
Oh
people don't
gosh,
realize that and they'll just
oh my God.
accept it.
Yeah, yeah, they're still a human being that can make mistakes, and like, just like the guy who told me, the pulmonologist, that I had cancer. That was a mistake. He thought he was right, but he wasn't.
Correct, right? Like, and it's okay for you to have a second opinion. And they shouldn't be offended by that.
Right?
They should be empowered by
Yes.
that.
Yes.
Like so they can collaborate and in some healthcare systems and they are trying to get the doctors to do that by offering you know uh, electronic records being passed back and forth in portals, which really does help keep uh, the doctors a little bit more educated. One of the things that I did when I went through my cancer journey, and I have redone, I pulled out and created a new one, is a medical binder.
Hmm.
And you all of your lab reports, all of your MRIs, all of your X-rays, all of your stuff, you just print it out so
Hmm.
that when you go see a new doctor, and they ask you your records. Okay, well here's the list of all the medications I'm on or not on. Here's all of my allergies. Here's the last time I got blood work, and here's what the results were. Here they are, like right
Yeah,
here.
that's
And that
right.
way you don't have to worry about any of that. And I'll
Mhm.
carry that to a doctor appointment and like, when was your last whatever? Just open it up and it's right
Yeah.
there.
Beautiful.
And what's beautiful about that is you can start that for children and they'll have their entire medical record in
Wow.
one spot. And I wish I had,
Mhm.
so 5 or 6 years ago, my husband and I were going through boxes and I found my medical record binder for my cancer journey. And in a healing cleansing activity, I destroyed it.
Mhm.
Like
Yeah.
now I'm very sad that I did that because that was a wealth of knowledge.
Yeah.
But at the time, it was what I needed. I needed to just do that. But
Somewhere
yeah.
there's somewhere there must be records of it though. You know, I don't know. I would think.
So yes, but the record retention
It's
is
10
not as
years.
long as you would like it to
Yeah,
be,
yeah,
right?
I
Like,
see.
so the insurance companies, they keep the records. I think it's 7 or 10 years, but they don't keep them actively on their system for longer than 2 or 3, depending. And they have to archive it, and they have to hold on to the archive for a certain number of years based on federal law, and then they can just destroy them.
Mm,
But I don't know if that's the same for hospital systems, because I don't work in a hospital system. I don't know that. 17 years, I don't know that
yeah,
anybody's going to have those records.
yeah, probably not. Yeah.
Probably not. I had them, but I decided that I didn't want them anymore in a rash decision of
Yeah.
rebellious joy. But
Mm,
yeah, like it was a big part of, because it was my portable brain, right?
yeah,
You
yeah.
got chemo brain going
Oh,
on. You don't remember what you had for breakfast, even if you had the same thing for breakfast for the last 3 years.
yeah, yeah.
And
Mm,
yeah, like I was constantly being asked what was going on, and I would just hand them the book, and they would make notes in it, print off stuff, and help me keep my binder beautiful by giving me more notes on the current activity, whatever it was, whether it was blood work or
mm. Oh, well. Still,
yes.
you're moving towards greater and greater health now. So good on you.
Yes, and everybody's health journey is going to be different.
Yeah,
And it
yeah. Y-
yeah, it is, but
Well, that's because everybody's body is different. Yeah.
yes.
And
And it's not like it's your personality, it's your mind, like
yes,
it's your aura, it's your whole complete self. And when you're going on a healing journey, and I kind of think our lives are one giant healing journey,
mm, yes,
it's individualized.
it
It is
truly
your personal blueprint, and you get to make all of the decisions for
is.
yourself. And so every day I get the chance to be a little better.
Yes,
Some days I do not succeed.
according to your standards, but
Oh, and they're rigorously ridiculous
right,
sometimes.
exactly, exactly. You
But
can't
that's how
listen
we
to that.
are with ourselves.
Yeah, yeah. But yeah, it's hard to know what to do when you're confronted with a diagnosis such as cancer, because whether you do a traditional or non-traditional or a combination of those, you don't know if that's right for your body. And so I tried all different things for myself, all kinds of alternative things, still not knowing should I have had the surgery, should I have the follow-up radiation. They don't do chemo for kidney cancer. They just do radiation. Just heard that's pretty bad too.
Just
Just, yeah. But and it's hard to find kidney cancer. The thing is that there are no symptoms, and so it was found on me on a CAT scan,
random Tuesday.
a
Yeah.
random yeah, random Tuesday, exactly. And in a CAT scan, and uh they don't usually go down that far, or at least they don't tell you. And anyway, so it I forget the point I was making. The
Yeah.
that Oh, you don't know what to do when you're confronted, because we all know people who did everything traditional, and they lived and they're happy and thriving, and some people went totally the opposite, and they lived and they're thriving, and then people who didn't live, whether what either way, so it's
Yes.
hard to know because you're always wondering, at least I was wondering, am I doing the right thing by choosing what I chose?
I didn't do any of that while I was all up in it, to be perfectly honest with you. I set the plan, and then we put the plan into motion, and then
That's good.
I had, I'm going to call it tunnel vision, right? Like,
Okay.
and I think that a lot of survivors end up in this tunnel, right? Where it was, okay, so today is blood work. Then we
Mm,
go do the blood work.
yeah.
Okay, today is, there's no medical procedures today. We get to walk in the grass and pick our nose. Okay, the next day we go and we have this exam, and it was like that day after
Mm,
day for almost a year for me.
mm,
And it wasn't until afterwards, I certainly didn't at the time think about a time after cancer. And I think I made a mistake there. I think that it's super important to think about your future and what your future could look like, because if you're thinking about it, you're telling the universe and your mind that there's going to be a future. I did not do that, and I highly recommend that you do that, right? Like, think
mhm.
about the after. And I could not conceive a day where I my mind wouldn't be consumed with the fact that cancer is a thing. And here I am 17 years later, and not only were there days, there were weeks and months where I literally forgot that I'm a cancer survivor. I'm out
Okay.
there just
Yeah.
living my best life. Now that
Uh-huh.
I'm helping people, that really isn't a thing anymore. Like, cancer is always, I'm always aware of it, but I don't live my life with cancer colored glasses anymore.
Good.
And I know that for the first couple of years, anytime I went to an appointment, there was the fear, right? Like, anytime something was scheduled or any random symptom, is it cancer? And I know that a lot of survivors have that, and have that for a very long time. I would say 8 or 10 years, maybe,
Mm,
for me. And that's going to vary for everybody.
right.
And I have had several cancer concerns in the last couple of years where we went and we got testing because of weird symptoms, and both times it turns out no. The most recent one was a pap not a pap smear, a mammography in December, where I do have masses in both my breasts, and I ended up having a biopsy. The biopsy results came back fine.
Good.
But
Good.
we are following up in August.
Mm,
So we're following up in August.
yeah.
But
Yeah.
that, you know, I always end the show on this note: get to your routine testing. And the routine testing is, and I'm talking about your colonoscopy too, people,
Oh, mm,
because colon cancer is,
on the rise. Yeah.
well, it's, yes, it's on the rise, but it's findable if
Mhm.
you do the proper testing. uh, it there's not many symptoms with that either, right? uh, but it's something that they can find with a simple procedure. Is it a comfortable procedure? No. I've had several at this point. It's not the most comfortable thing. However, it's super important. So,
Yeah.
based on your age, your gender, your family history, and what your doctor recommends, and your insurance company also has recommendations when you should be getting your mammographies, when you should be getting your colonoscopies. Schedule these. Your pap smears, ladies, please do those. I heard somebody say that, they don't need to have pap smears because they had a hysterectomy. I'm like, that's blatantly false.
Mm,
I still get them.
wow.
You still
Yeah, I didn't
have,
know that.
yeah, like, you
Oh,
you
wow.
you still have a vaginal canal. and
Mm-hmm.
and I don't have a cervix, but I have the top of the canal, and cancer
Mm-hmm.
cells can gather there. Like, it's
Sure.
still something you should do, right?
Mm-hmm.
So I think it is super important.
Very good. Very good.
Mary Fran, I want to thank you so much for being on
Oh,
the show today.
oh,
I
thank
really
you.
appreciate it.
Oh, you're so welcome. I'm so honored to be here. Thank you, Tonya.
You're welcome. Until next time, Cancer Warriors, go get those tests.
Okay.
Goodbye.